Hi, my name is Diana Wong, MIT 213178, and today I'll be presenting on assessment 2. Paper 1, Artificial Intelligence Ethics of AI and Ethical AI. This paper talks about AI in the context of ethics, which specifies the moral obligations and duties of an AI and its creator. Ethics are divided into two: roboethics, which is concerning with moral behaviors of humans as they design, construct, use, and interact with AI agents. Machine ethics itself deals with moral behavior of artificial moral agents, which is more in the field of research addressing designs of artificial moral agents. Ethics issues of AI falls into three categories: the features of AI that may give rise to ethical problems. So, an example would be transparency. Human factors that cause ethical risk would be human bias and the social impacts of ethical AI issues. So there will be an example of how AI creates an automations and therefore is deemed to have a social impacts because of job loss by humans. There are three potential ways to transfer AI to ethical agents. It is by to train AI into an implicit ethical agent, that is by constraining the machine's actions to avoid unethical outcomes. The second one would be explicit ethical agents. So this is by stating explicitly what action is allowed and what is forbidden. So you draw a line on what an AI agent is able to do and what they are not allowed to do. Fully ethical agents is the most advanced one, where the machines act as if they are humans and they have consciousness and intentionality and free wills. So I believe we're still on the stage of implicit ethicals and going towards explicit ethical agents. Paper 2. Paper 2 talks about AI assisted decision making in healthcare. It is important that developers and implementers of AI assisted CDSS not put in place control mechanisms to protect individuals groups from harms and arising through the tools. The key issues of using AI assisted CDSS will be accountabilities and transparency of the decisions of AI system make, potentials of group harm arising from bias built in algorithm. At the end of the day, all of the AI assisted are all built by humans, and therefore we will try to avoid those. Public interest in generating more efficient healthcare and AI assisted systems, potential conflicts, professional roles, and duties of clinicians. So, in a way, because they are both users and generator of research data for AI assisted systems, the case studies that was discussed in this paper is AI assisted CDSS in the end of life care. By building an app that solely means to ascertain the likelihood of survival to discharge, as well as imminent death and suitable of withholding and withdrawing treatments, have the potential to evoke the trust given to the doctors and to the medical professions more generally. So I believe that the AI-assisted CDSS should be used more for a facilitator rather than the end results in decision making. In case where the use of apps resulted in a decisions where conflicted between the health profession, it will be imperative that the clinical teams responsible for the patient could understand the basis of its decision to ensure that the technology provide maximum transparency. Paper 3. So paper 3 talks about the openness in big data and data repositories. Nowadays, in order for researchers to get fundings or their research to be published, there is no expectations and requirement for them to provide their research data in data repositories. These publications focus mostly about sharing data through online data repository. The advantage obviously is online data repository creates a central pools of data and make the data easily discoverable for researchers worldwide, especially for countries that are not able to do their own research. But the challenging towards that is to provide a governance for the data repository. It's the questions of whether how much access and how much restrictions that should be applied, and to what level does a researcher ability to make use of the data repositories. And obviously it's to do with the qualities of data and formatings as well. The main key issues of the open data repositories, obviously privacy and confidentiality. There's also access restrictions and transparency governance. The researchers are mostly concerned about the data ownerships and the fair attributions of credits. The case study that was provided in the paper is sharing individual patients' level data in data research. So the decision making whether the research data should be available in the data repositories. The last paper, which is paper 4, it's about big data and public-private partnership in healthcare. So PPP is a collaborations under contracts, which is provided by a collaboration between public and private sectors. They act together to try and achieve what each acting alone cannot be achieved. These collaborations raise ethical issues such as social licensing, ownership, and commercializations. The 4 principles that are used to review the ethical issues are public benefits, stewardships, and transparency and engagements. The case studies that was used for this case is NHS data sharing agreements with DeepMind, which is owned by Google. So NHS provide patients' data to Google to develop an app for kidney disease. And in 2015, NHS provided Google DeepMind with 1.6 million identifiable medical records to test a smartphone's app called Strings. Okay, the summary of this my paper is understanding and addressing ethical and moral issues related to AI is still infancy stage. AI ethics is not simple about right or wrong or good or bad or virtue wise. It is not even a problem that can be solved by small groups, and therefore the earliest that we understand or at least have an understanding of the ethical issues and trying to discuss it is the better. That's the end of my presentations. Thank you.